Hello, my name is Dr. Ralph Kleef. I'm a medical doctor in clinical practice and research since more than 30 years, focusing on the topic of cancer with integrative methods. We decided to start a small series of videos to introduce all of you to our work. In the last 30 years, I've seen about more than 20,000 cancer patients, and I understood finally that it is not only chemotherapy or radiation or surgery which is a solution to treat cancer, but it's much more broader and much deeper than we can all think of. It is about the power within, which is our immune system. And many of the so-called alternative treatments now are entering the mainstream, such as hypothermia or immunotherapy. Personally, I'm very happy about this. We see that methods which have been laughed about some years ago now suddenly have been accepted due to good clinical studies. We are also trying to publish our work in a series of papers which already can be found on Medline. My main focus in trying to bring patients into remission and prevent that cancer ever will come back is the immune system, and here we are studying very closely the power of fever. It was Rudolf Steiner himself, the anthroposophical founder of anthroposophy and the Waldorf movement, who introduced mistletoe therapy to the field of cancer. Mistletoe, if it's used correctly, clearly improves body cold temperature rhythms. And if you ask my 20,000 patients, did you have good fever in your last 10, 20, 30 years? The majority would say, fever, we don't know what that is. So in our treatment, hypothermia, we are using fever to induce remission. And the beauty is that this is not an alternative treatment. It is well complementary to all the new so-called targeted therapies, to chemotherapy and to radiation. For radiation, for example, hypoxia, which means a purely saturated oxygen in the tumor areas, is the #1 resistance mechanism towards radiation. And that's what hypothermia can overcome. This has been published in many studies since decades. So we are very happy that we are seeing a new dawn in oncology, and I would call this integrative immuno-oncology.